Okay, so today we're going to talk about a very important subject that I find there tends to be a lot of confusion over. And the subject is, what is it going to take to get this problem fixed? And unfortunately, the simple answer is it's going to depend. And the reason I give that comment is that patients, when they're healing, generally go through three main stages of care as they're working towards true health. Now, the first stage of care is usually relief care. Patients are coming in with pain, and our goal is to, as quickly as possible, help them get out of that pain as we can help them with. But an interesting thing about symptoms like pain is it's actually one of the last things to show up after the problem has been progressing for some time. But on a good note, pain is one of the first things to leave as the patient is healing and improving. But it is important to understand when you get to that point that pain is finally gone and you're feeling much better, that's fantastic news, but you have to understand you're just to that point. All of these problems are still going to be there. And that's actually where the true long-term healing begins to take place, where we start working with our patients in the corrective care stage. Now, the corrective care stage is where we're actively working on correcting these problems and fixing them so that they can have long-term relief. But an interesting thing about the corrective care stage is that most of our patients that are coming in for treatments during that stage of care are coming in, but they're not really in any pain. They're just coming in to be proactive to correct and reverse these problems so they don't have to deal with that issue later on in life. And then when the pain is gone and this has all been corrected, that's finally where you get to the point of wellness or maintenance care. When you get to wellness or maintenance care, again, this has been corrected, they're not in pain, but it does generally just take a little bit of work to keep it that way, because you don't want it going back. But the maintenance care stage usually is just very simple and it doesn't take long and involve a whole lot. But just like your teeth, once you get that cavity fixed, you're going to want to do a few simple things to keep it that way. But it's relief care, and then corrective care, and then finally wellness care. And I would just ask, where are you in that course of treatment? If there's confusion, ask one of our doctors when you come to our next appointment, what stage of care am I in? And we'll be able to discuss that with you. Hope that helps. Have a great day.